Cloudnine Hospital, Kalyani Nagar, Pune. Today I'm going to talk about something called as preconception care. Preconception care and counselling is required to know whether you are fit before you plan a pregnancy. Now there are few basic things to know. One is to have a normal BMI. So basically, which means your weight should be adequate for your height. Normal range is between 18.5 to 25, and you should do regular exercise and have a balanced diet to maintain your health. The second thing would be to think about starting on folic acid supplements. Folic acid is a very small vitamin of the B complex group, and the basic requirement is around 400 micrograms per day. So normal commonly available preparations in India usually has around 5 mg of folic acid, and once a day tablet should be good enough. Ideally you should be on it 3 months pre-conception. Folic acid helps to prevent spinal cord disorders or neural tube defects in the baby. Once you are pregnant, you get to know only when you miss your periods, which is by 4 weeks, by the time the baby's spine starts developing. Hence, it's important to be on folic acid pre-conception, 3 months pre-conception ideally. So be on 1 tablet per day. Few tests that we do includes thalassemia screening, which is a very common genetic condition which involves hemoglobin gene. If you come as positive for thalassemia trait, then we check for your husband's test as well. Because if both of you come positive for the trait, then there is a small chance of 25% chance of baby having thalassemia disease, wherein the baby needs blood transfusion lifelong. So it's important to do genetic counselling if both of you come positive for the thalassemia trait. If only one parent has the trait, then it's not that significant, as small chance of, again, a 25% chance of baby also getting a trait wherein the hemoglobin remains slightly on the lower side. Other important tests include testing for rubella immunity. Rubella is a very common viral infection. Most of us are immune to it, but rubella during pregnancy can affect the baby so much so that termination is advised. Hence, to know the immunity pre-conception is important. If you are immune, then nothing needs to be done. But if you are not immune, then you may need vaccine for it. And because it's a live virus vaccine, you should ideally not plan pregnancy for at least 1 month after taking the second dose of the vaccine. Few other simple tests like checking for your hemoglobin, knowing your sugar values by doing a HbA1c or a random blood sugar, doing a thyroid test, because thyroid is a very important hormone for baby and you as well. So what I would suggest to do preconceptionally. Simple tests for HIV and hepatitis also is important. I think that's all for the initial tests that are required. Thank you.